Imagine a world where preventable diseases run rampant, and the very foundation of public health is under siege. This is the stark reality we're facing today, as Robert F. Kennedy Jr.'s anti-vax agenda continues to infect America. For months, the Trump administration has been waging a full-scale attack on our public health system, with Kennedy, the Secretary of Health and Human Services, leading the charge. The latest escalation in this assault is the attempted firing of Dr. Susan Monarez, the director of the Centers for Disease Control and Prevention, CDC, after she refused to follow Kennedy's advisor's attempts to restrict vaccine access. But here's where it gets even more concerning. The Trump administration has already tried to limit access to COVID vaccines, approving updated vaccines only for people 65 and older, and those with certain pre-existing conditions. And this is the part most people miss. The CDC's advisory committee is set to meet in mid-September to make a recommendation on who should be able to get the shots. But with Kennedy's deputy, Jim O'Neill, now at the helm, the outcome is far from certain. I spoke with Dr. Paul Offit, director of the Vaccine Education Center at Children's Hospital of Philadelphia, to understand the extent of the federal government's power to restrict vaccine access and what Kennedy's true intentions are. Dr. Offit explained that the CDC's recommendations are crucial for vaccine uptake, as they provide guidance for doctors, pharmacies, and insurance companies. However, with Kennedy's recent actions, the CDC's role has been undermined, leaving many to wonder what the future holds for public health in America. But what's really at play here? Is it a genuine concern for public health, or is it a politically motivated attempt to restrict access to life-saving vaccines? The answer, unfortunately, is clear. Kennedy's agenda is driven by a misguided ideology that prioritizes conspiracy theories over scientific evidence. And this is the part that's most disturbing. The Trump administration's actions are not only putting lives at risk, but also undermining the very foundations of our public health system. As Dr. Offit noted, the goal of vaccination is to keep people out of the hospital, out of the intensive care unit, and out of the morgue. So, why are we making it harder for people to access these life-saving vaccines? The controversy surrounding vaccine access is not just about politics. It's about people's lives. And this is where we need to ask ourselves, what kind of society do we want to be? One that prioritizes the health and well-being of its citizens, or one that succumbs to the whims of ideology and conspiracy theories? The choice is clear, but the outcome is far from certain. As we move forward, it's essential to remember that public health is not a partisan issue. It's a matter of life and death, and we must demand that our leaders prioritize the health and well-being of all Americans, regardless of their political affiliations. So we ask you, what do you think about the current state of vaccine access in America? Do you think the Trump administration's actions are justified, or do you believe they're putting lives at risk? Share your thoughts with us, and let's start a conversation about the future of public health in America.